glasses had the weirdest reflection the whole time.
Oh, really? Because it was like this.
Yeah, but this looks better.
Okay, we are live on Instagram, and now I'm setting up Facebook.
Okay, good morning. Welcome to our virtual open house 2020. My name's Jen. I'm a nurse injector here at Nyack Plastic Surgery. This is my beautiful patient, Pam. We're going to do some Botox and filler this morning. Just a little overview on Botox first, and then we'll go to filler. So Pam has had Botox and filler before. Botox is great for in between the brows, that glabella area. Recommended dose is 20 to 30 units. That's average. Forehead, we're going to skip for her. If you were to treat your forehead, average is looking 8 to 10 units. And then the crow's feet we're going to treat today. Recommended dose 20 to 30 units for the patient. The reason why we're skipping her forehead today is we're going to try and give her the ultimate kind of lifting of the brows. So that natural lift, and then the crow's feet too, with a little bit of a lateral lift in the brows. We're trying to open her eyes a little bit. Obviously don't want to make her look starstruck, but we want to open, make her look refreshed. And if we are treating the forehead, its main job is in charge of raising and lowering those eyebrows. So we don't want to relax her brows and give her a lower appearance. We want to actually give her that lifting. So Botox, we recommend it every 3 to 4 months for optimal results, and we say about 2 weeks takes for full results. Really no downtime with Botox, which is great. So that would be our plan. We're going to do about 24 units here between her brows and 24 units for her crow's feet. And then for filler, great for that lower face. So for her, we're actually going to try and build her cheeks. So cheek filler, which is Voluma, that is so powerful for a patient. It's one of my favorite treatments to do. It is going to, we have a major fat pad here, and as we're younger, we have that natural V shape. As we get older, things kind of tend to fall, which gives us the folds, the marionette lines, and the jowling. So we're going to try and improve that, and we're going to restore that fat pad with a little Voluma kind of lifter here. So even by doing that and demonstrating, you can see how it even improves the lower lid, under eyes, the folds, marionettes, and then the jowling. Same on this side too. And then we're going to actually target kind of here in the folds and then the marionette lines. So
What filler would you recommend for someone in their 40s to give them a natural look but help with volume and the upper lip lines?
So are we talking the lips though, volume? Face volume loss?
I think they mean just facial volume loss and then specifically the upper lip lines.
So Voluma is great to restore that mid-face volume loss. Great for all ages. I don't even put an age on filler because everybody's anatomy is different, and then also we lose volume differently too. A lot of that is genetics and how we age too. So I don't really put an age on filler. I have a lot of younger patients that love Voluma just to help prevent the actual aging process too. So we're gonna get started. We're gonna do some Botox first. Okay, maybe turn towards me a little bit. I'm gonna have you frown.
Will it make cheeks chubbier or change people's smile?
No, so it should not. If it's injected correctly in this, obviously if you don't need it, filler adds volume to the area, so that's up to your provider on whether or not you need that. But a lot of times when you do cheek filler and you treat this lateral side for younger patients who might have that great fullness in the front, like the apple of their cheek, targeting this lateral side can give you that natural contouring look that a lot of younger patients, like even like older patients, we just do a little bit more out here and here. So more of the full cheek. Frown for me.
Does bruising occur with all filler and Botox as it does when you fill the lips and get bruises in your lips?
That's a possibility too. So anytime you do Botox, there's a risk for more of like a pinpoint bruising compared to when you do filler. With filler, there's going to be a greater chance of bruising and swelling. So the lip area is definitely a very vascular area, so we say count on bruising and swelling. When you do the cheeks, marionettes, and then the folds, there's always that risk because there's lots of vascularity in the face. So we try to do everything we can to diminish that risk, but there's always going to be a risk no matter what we're doing, what filler we're doing, and where we're doing the filler. So
will cheek filler help rid the parentheses around someone's mouth?
Yeah, so go ahead and smile for me, real quick. Relax for me. So back in the day when we first started doing, fillers, we would always just kind of fill around the mouth area. Like just go ahead and fill the folds, fill the marionette lines, and then you're finding you're just too full here. So we're actually treating the cause of the heaviness with those parentheses around the lip area. Why that's happening is because we're losing this mid-face volume loss. So we are correcting the problem, but we're also going to target a little bit here, but we don't have to use as much filler here. And then we're actually going to correct the problem and lift her. So the filler down here is going to go further.
Can you get filler and Morpheus 8 on the same day?
So I would say no. Reason being is with Morpheus 8, you're actually going to swell a little bit. So we suggest, we suggest doing those on 2 different days because of the swelling that you're going to get from Morpheus 8.
Okay, and then how do you decide what kind of filler to use? Someone asked.
So it depends on the patient and expectations, and also the area that we're going to treat on the face too. So we offer all hyaluronic acid fillers here, which that means that they are dissolvable. So with that being said, is we pick the best filler for the certain area of the face, the patient, and then the ultimate end result too. So my goal, like in every injector here, our goal is to not make someone look like someone they're not when they walk out of here, but just a natural appearance, refreshed feel, and natural aging. So we want to age gracefully. So that's what, our end goal is. So we're going to move on to filler. We're going to start with her cheeks first and work our way kind of down, okay?
Everyone's loving this live video.
Yay! So we're going to do something, I think earlier we used the needle. I'm going to use the cannula for the cheeks. The cannula is almost like a blunt tip, so it is going to help decrease the risk of her bruising and then also swelling. So it looks almost like a little catheter, the best way to describe it. So that's what you're going to be seeing me use today, okay? Let's get started. So if you tilt up your chin for me, if you want to use the vibration device, you can. This little tool is a vibration device. It's just going to help kind of just the nerve endings, take her mind off of what's going on. Make a little pinch here, okay? This is the entryway for the cannula.
Someone said cheek filler is different than under eye filler, right?
Correct. So with under eyes, you want to make sure you're using a thinner filler, very thin area. So we would use something a little thinner. Voluma is a very thick filler, longer lasting filler too. Because this is we're going right over bone with this. So you want a thick filler to give you the ultimate lift. Okay, here we go. So this is the cannula. I'm pulling a little bit, okay?
Can you do filler and Morpheus 8 on the same day?
No, so just because of the swelling, we don't recommend doing that.
Okay. And then how many units did you do in between her eyebrows?
I did 24 units. Average dosing's 20 to 30 units for a patient, but I did 24 kind of right there in the middle. She's had it done before and it's worked great for her.
Can filler be used to fill acne scars?
Yes, it's a great treatment for acne scarring. So what we recommend for acne scarring is a series of Morpheus 8 and then filler.
How long does filler last?
So longevity for filler is different for each type of filler. The one we're doing in her cheeks is marketed for 24 months. I don't tell patients you don't need anything for 24 months. I always like to say yearly, you probably need about half of what we start with. And we want to keep up with the filler. We don't want to wait till it completely depletes and it's gone, because then we're kind of starting over. So what we want to do is just kind of stay on top of it and not wait till it's completely gone. But the one that we're doing right now on her cheeks, which it's a great result already. That looks awesome. So what we did is you can already see her results immediately after. Restored that volume right here on the right side, and you can tell the difference already from her right and left. So
Someone's asking if this is painful.
how's it feel?
Mild.
Okay, great.
Mild pain.
Yeah.
Did I ask how long this lasts?
Yes.
I did, okay. What kind of filler are you using right now?
Voluma. So Voluma is great for the cheeks. So normally average we use 1 syringe per cheek. Some patients need, can you get away with doing a half per side to equal 1 syringe. And I do have some patients that need, more than 1 syringe per cheek if they have quite a bit of volume loss. So
Will under eye filler get rid of the line when you smile under your eyes?
Um,
Thinking that roll.
the roll, not necessarily it's going to get rid of that, because if it's a true line and wrinkle from movement, that's going to be a different treatment. Filler is going to restore the volume loss, so the actual valley that you have in the tear trough, which is kind of right in this area. So when you still smile, you still are going to have the lines and wrinkles from the movement. So, okay, here we go. So we're just going to use that little needle poke, and we're just going to deliver the filler. So with the cannula, you feel just like a little bit of tugging and pulling, a little bit of pressure.
You probably can't move your left hand at all, can you?
This one? Yep.
Yep. Perfect. Let's answer some more questions.
Yep.
How many Botox units do you need for a lip flip?
Lip flip, we normally start with 4 to 6 units. You can do more, like 8 units if needed.
How long does it take to see the effects of filler?
So filler you can see pretty immediately, but then you start to get some swelling a little bit. Maybe turn towards me a little bit, thank you. So you can see it immediately. So like as an injector, I can see it immediately. But then you start to get some swelling a little bit that comes naturally. I always say the first 3 to 5 days are going to be the worst for swelling and bruising. And then it's going to take that full 2 weeks for full results.
And someone said, if I want to take advantage of the open house special, how do I know how much to buy? So obviously that changes per area.
Yes.
So if you were to generalize how much filler, so if someone wanted to get their lips filled for the first time, how many syringes?
I would say for the first time I would just go with 1 syringe of Juvederm.
Of Juvederm?
Yep.
And then tear troughs, how many syringes?
So that's average 1 syringe. There are some patients that need 2, but majority of patients just need 1. So just to give an idea, like how much filler is, so 1 mil is in 1 syringe. 5 syringes is going to equal 1 teaspoon. So, you know, when I was talking to Pam before we started, she's never had like more than 1 syringe. So I always like to do a consultation with my patients and go over kind of everything with them before we get started, because everybody's end expectations is different. But for her, when I said 4 syringes, I think she was like, oh wow, am I going to look different? No, the good thing is, like I said, 4 seems like a lot, but hang in there, sorry, you can pay attention. But 5 syringes equals 1 teaspoon. So not much filler. So just to give you an idea when you're thinking about purchasing too.
And she said teaspoon, not tablespoon. So
Yeah,
that's
teaspoon.
5 syringes
Yes.
is 1 teaspoon.
Teaspoon.
If you get filler under your eyes, or
Yes.
no, do you have to get filler under your eyes if you do cheeks?
You do not. So you don't have to, like, I have a lot of patients, like, her under eyes look, I mean, are like I already treated them just by doing her cheeks. So like I said earlier, cheeks are very powerful. I love treating the cheeks on patients because it really restores that mid-face volume loss, helps the under eyes, helps her folds, the marionette lines. I need less filler around the mouth because I treated what is causing that actual heaviness. So it looks really good.
Someone said, what is she holding on her chin? The vibration device.
So this vibration device helps, it's a distraction technique. So it just kind of takes those nerve endings away from like knowing what's going on. So it just makes it more comfortable for the patient. Okay, we're gonna start kind of around the mouth area. So we're gonna do Juvederm Velour. We're gonna use the cannula method too, so.
Does Botox or filler help with buccal fat around the mouth? Ooh, that's a good question.
So for buccal fat, that fullness, most of the time, you know, we refer to Dr. Nayak for that because where you're already full in a certain area, so like if you're fuller right here, yes, we could do some filler up here, but if this is your main, like, area of concern of fullness, most of the time you don't want to add filler where you're already full. So.
Right.
This person said, thank you so much. This is really helpful for those of us who have never had anything done.
Oh, awesome.
Some people are saying this looks super painful. Is the patient in pain? She's laughing, guys. She's fine.
Not much at all. Okay, here we go.
Someone said, I just moved to St. Louis. I usually get Botox every 3 months, 50 units. But I don't know how many units she puts where. Would that cause an issue on you deciding somewhere new?
So, no, we get a lot of patients from, like, that have just moved here or been, you know, elsewhere or just starting fresh with us. It's kind of nice to start fresh. I mean, I see every patient that I see, I kind of start fresh. Like, so we kind of review. We don't get into that whole routine of, okay, this is how many units you've done previously. Has it worked? But there's a lot of times we want to like kind of reassess because things change. So it's kind of nice to start new. Obviously, it's nice to get a history of where you've been treated, what's worked, what's not worked. But it's nice to kind of start fresh and just revisit what's bothering you, what we recommend too. So, and then go from there.
Is there anything to help the lines under the eyes?
Yes, CO2 Laser Resurfacing, which we do free consultations for. The best thing for that, like I said, is a CO2 laser. It's best way to describe it is it irons out the wrinkles. So,
can you work out after you get this done?
so I always say about 24 hours.
And
Go ahead.
is this painful or sore the next day?
So you're gonna get a little bit of soreness just because. Megan, will you hold right here for me? You'll get a little bit of soreness, and inflammation from the cannula. Obviously, if you do get a little bruise, it'll be tender to touch. But most of the time, I don't have patients that have said they're like, and you don't want to feel pain with filler anyway, but they're a little sore, but it's not anything to be, that is going to conflict with day-to-day activities. Most patients go work out, and they're like asking to work out before 24 hours. So I would say no.
And then a lot of people are asking if we numbed before this.
I'm sorry, what did you say, Jenna?
If we numbed before this.
Yes, we did. So we have a great numbing. She numbed 20 minutes. 20 minutes prior.
And so would you say that yearly touch-ups are recommended with cheek and under eye filler?
Yes, I would say yes. Like I said, I would keep up with it. I wouldn't let it completely deplete. So most of the patients I recommend following up every year just to do a little touch-up and keep up with everything.
Oh, Jen, you'll like this question. Can you use Voluma for the chin instead of a chin implant?
Yes! One of my favorite things to do.
Jen loves her chin and jawline filler.
I love chin and jawline. So cheeks, chin, and jawline are like my favorite places to treat. It's amazing. So we have a lot of before and afters that we could even show too. But yes, you can. So if you're treating your chin and jawline, you're looking at about 1 syringe on the chin for Voluma, that is. And then about 1 syringe per side for that lateral jawline. So about 3 syringes total to treat that lateral jawline and then the chin. It really helps with the submental fullness that patients get, or the jowling too.
And it's also a great option if you maybe even have been told that you're a chin implant candidate, but you're not ready to have surgery. You don't know if you will like it. You're not ready to make that jump. It's a great way to start with Voluma in your chin. See if maybe that's
like it.
See if you like it. Maybe that's all you want. Maybe you will say, okay, I'm ready for a chin implant. It's a great option.
Yeah.
And to touch base again, this is which type of filler is this?
This is Juvederm Velour. So it's a Juvederm product, so it's under the Group A pricing. So Juvederm Velour. I really like that for around the. Look at this. It looks so good.
Yay.
Looks great. We hold right here.
Yes, someone just said, is this the same brand of filler used for tear troughs? So if you're looking at our specials on lines, you'll see there's Juvederm and Velour. There's that group of fillers, and that's all the softer areas, right, Jen?
Yes.
You want to talk about those?
Yeah, so there's Group B pricing, which is the Voluma. So Voluma is great for the cheeks that we just did. It's also great for the chin and the jawline. Some of those patients that want like Instagram full lips, that's a good one too, the Voluma. Like I said, Voluma is like the thickest product, so it's going to give you that lots of volume. So some patients use it for like those lips that you want really full Instagram lips, the chin, the jawline, and the cheeks. And then we have the Group A pricing, which is the Juvederm. So that is our Juvederm Ultra, Juvederm Velour, Juvederm Voluma, and Juvederm Ultra Plus. So those are going to be more for the tear troughs, the lips. We can use those for the folds. So we just did that. We used for folds, the Marinette lines. Most of the time, a patient needs about 1 syringe for the tear troughs of Juvederm. Then for this area, which is the nasolabial folds, 1 syringe. And then the Marinette lines would be another syringe. So you can use those there. Those would be like our key areas that we would treat with the Juvederm. So as you can tell, her results, you can already see a huge difference in how much she's lifted.
People are chiming in saying that.
It looks wonderful. And this was with 4 syringes. So we did 1 Voluma per cheek, we did 1 Juvederm Velour and another Juvederm Velour. So that's 4 sturges, not even a teaspoon of filler in her. So, and how do you feel?
I feel fine.
Yeah, so she can put, we recommend if you don't have to put makeup on to wait till the next day.
Mm-hmm.
So I'm going to give her some ice. She's going to ice on and off, like 10 minutes on, 10 minutes off. She hardly bled. I don't see any bruising, which is awesome. So we do recommend if you're going to get treated to try and avoid blood thinners 2 weeks prior. So ibuprofen, aspirin, fish oil. Obviously, if you're on it for health reasons, continue it. But that will help decrease the risk of bruising. Icing afterwards, and just 2 weeks for full results, because there always is a risk, even though she's not showing bruising now, for tomorrow. So other than that, are there any other questions do we have?
Well, so we're nearing the end of our live. There are still lots of questions.
Okay.
Some of them have been answered, but if your question was not answered, please text us at 314-991-5438. We will be happy to answer you. And
Thanks, guys.
thank you, Jen.
Thank you.
That was
You did great.
awesome.